Shipra, thank you very much for the introduction of the topic. And also, I will take a little while to bring Sougat into the conversation. Uh, Before that, let me set a little context for about a minute or so, and I will encourage all of you to participate in this conversation rather than just listen and have a dialogue than a monologue. Uh, Let me begin with this, you know, playing a devil's advocate role here, that digital transformation is CEO's job. Is it really a CEO's job? And if it is, then what is the job of a CIO or a CTO or a CDO? Um, in my limited understanding, while working with all of these great personas, while it is true that everyone has a role to play in the build-up or to sustain the digital transformation, however, it is only a CEO who can make the fundamental changes required for a successful digital transformation. Now, with that as a premise, I again welcome my guest, Sougat Chatterjee, who is the Executive Director and CEO of Abhay Health. Now, what is Abhay Health? Is a multifaceted healthcare business conglomerate with diverse interests in a wide range of innovative products and technology-enabled services. It offers a diverse range of product and services through end-to-end manufacturing capabilities and a distribution network spread across the country. I hope I described the organization perfectly.
Sure you have.
Great. So my first question to you, sir, is how do you stay abreast with emerging technologies, and what criteria do you use to evaluate their potential impact on the business? Can you provide us some examples of successful implementation of new age technologies in Abhay Health?
Sure. So Rahul, first of all, before coming to answer, a very warm welcome to all of you all, and thank you for having us here. Indeed, this inaugural session is a great platform, and you know, I'm particularly intrigued by the word business transformation, you know, which you use in the theme. I'll pick up a line or two when Arun was speaking today morning. You know, when he spoke about dinosaurs, it's a great relevance to give. But at the same point of time, the biggest movies which we have seen happening so far are when we have brought the dinosaurs back alive.
Yeah.
Right? So that's a good part of the story. So which means it doesn't die out. Two, you know, once again syncing to what Arun said and what you asked at the same point of time. In today's date, technology, and particularly when you say is CIO or a CTO a designation or individual, I feel it's not the same anymore. In fact, you know, there was a stage, once again going to the pre-dinosaur age, when we used to feel that, you know, learning or having to know how to operate upon a computer, or probably having the competency to run our MS Office would be a skill which would get you a job.
Absolutely.
Right? But the time has changed now. Now, that's something which you don't even talk about. Right? So, technology itself is a matter where anybody and everybody in the organization has to have the understanding of it. It's not restrained to only one single individual. And that brings me to this point, Rahul, when you ask from a CEO's perspective. You know, technology build-up is one part of the story, but effectively executing it is another part of the story.
Yeah.
And when we talk of execution, it's not the CTO or the CIO alone who's responsible for it. There are multiple stakeholders, right down to the guy who is probably just an intern who has joined into the organization a month ago, right? And what the CEO thinks would be good in terms of the future lineup, how the organization is going to transcend and transform. The same applies with everybody's unified thought, right? And without understanding the technology parameter, this dimension just cannot open up in the way it is supposed to be. Otherwise, just like the way we are having today, we will keep having bottlenecks time and again. Because when it comes to execution, there is a internal committee, there's a CEO, there's a company's internal IT, there's an external IT, there's a service provider, there's a cloud providing services, there's a technology enabler service,
Yep.
then there's an agency, then there's a person who is going to find out the gaps, and the worst of it all, you know, we all have been blessed with very smart guys in all our systems, you know. And the smart guys, they often come up with very smart hacks, right? So the hacks are good when it comes to a short-term cure. But when you are building a platform which is for a long-term deliverable, then, you know, those things are the parameters which probably, you know, we as organization heads probably, we would need to look into it more differentially. So giving you an example or two, so for example, Abhay Health. So Abhay Health, as we spoke of, is not just a health platform. For ages, almost for about now 6-7 years, we have seen a plethora of digi health platforms coming up in the industry, where we see everybody trying to collate data. Somebody speaks about mental health, somebody speaks about you know, preventive health, somebody speaks about the, I would say, the lifestyle disorder corrections, right? And everybody is accumulating data. But then the datas are only getting you this much, which is only informative. There is nothing curative, right? So I can have a system which can pick up your body's, you know, traumas, you can pick up your functionalities, and I can tell you that do this, and you will be good. But as an individual, as a consumer, whether I'm doing it or not doing it, is something which is not being measured there across. So what we are doing here is that we are building up a platform, and where in particularly technology along with the government's initiative of the digital health mission, we are building up a platform where not only we will do predictive, we will do preventive, and we will do curative as well. So we are supplying, we are coming up, we have launched 5 of them, we are coming up with another about some 100 odd variants, which will be home-based test kits. So you diagnose, and you keep diagnosing, because only predictive is not going to help you that much, because the AI has to be merged with the reality at the same point of time. And then after that, you get into a curative platform. So that's one part of the story. And here, working with, in my previous stint, I would tell you, when I was working with Apollo, right? So even an organization like Apollo, we had 8 different platforms. From a technology perspective, to merge 8 different platforms into one was a humongous challenge. Absolutely. So one learning which I took up from there, and which I was building in right from day one, is that how to ensure that we have a unified, flexible platform where anybody can be integrated without much of a hassle. So if that answers your question.
I pause you here, and I, with some human intelligence, I would say he's a very smart CEO, and bursts the myth that CEOs know little about technology. Am I right? Right or wrong? Okay, so am I allowed to improvise on the questions?
Sure. Please.
Because
Feel
I get some inputs from your answer. 2 very quick things. You know, you have given me to understand that everyone in the value chain plays a role in implementing and executing technology and the platforms that you spoke about.
Right.
However, the CIO has a stature, the CTO has a stature in the organization. So first question is, what do you expect the CIO or CTO to do in an organization? 2, what is the perspective of a CEO from data point of view? What do you expect your data to do to you?
So, and that's, you know, when you bring in a new CEO, CTO or a CIO into the organization, one of the key things which happens is that end of the day, we are humans, and we learn through our experiences, right? So there are things which the CTO has in the past done right and got some good results. There are things which he probably would have faced challenges, which to him would be, you know, steps not to be treaded, right? But at the same point of time, the business delivery for every organization, including ours, I would say, is very different, right? So the first job which I would expect from a CTO or a CIO to do is to probably spend some time and understand the organizational consumer need or the customer need, right from the grassroots perspective. probably by spending in the first 3 months more time with my frontline guys, with my sales team, with my delivery guys, and to figure out what is the whole expectancy all about. Because what we build internally, it has a reason to be built, right? It has to go and meet at some point of time with somebody who is the end user of it. So if that person finds it challenging to what we have done so far, so the things won't get married well. So that's the first expectation. Two, normally when we try to build up something, we talk about timelines, right? And here is something which I always feel the other way around, right? Just like the way, you know, when you cook something, a good dish, or, you know, it takes some time to kind of warm it up, it takes some time to marinate it. So if you don't do it right, probably the output of the dish will not be equally as tasty as you're expecting it to be. Same applies when you walk around in the format of a building up a technology platform, and the CTO has to be given that space and that understanding to walk around that, and not given a directive by which it's like to be like, you know, you have just probably X number of hours to deliver the output. So that's the other thing which I wanted to add on to that. And coming to your other point, from the base objective of a CTO or a CIO, you know, one of the key things which data which is generated from it, and most of the times, even when probably, you know, we are not doing anything, we are just moving from a place X to a place Y to do a X job and a place Y. We actually, at every point of time, we are gathering data, right? The objective is not to figure out how much data can we gather. The objective is to figure out, with whatever data you have, what all information can be degenerated out of it and given to whichsoever vertical it needs to be given. Quite frankly, we often consider data to be our gold mine and we sit on top of it, right, in a vault, which is true, which is important from the privacy and the security factors. But then the efficacy of the data, that can be transcended into multiple ways. And not only it has to impact sales alone, it can impact sales, finance, production, packaging, n number of sections altogether, both from the organizational and the organizational external partners. So data as a policy, I would say, should have a system where the CTO can walk upon that data, create the meaningful outputs of the data which is coming across to it, keep building it and improvising of time to time by the method of permutation combination, and feed it to the respective systems with the inputs which he is receiving. I think that's the key role which data should play, irrespective of whether asked or not being asked.
Great. So what, if I have to summarize your answer, the two parts of my question that I asked. The first part, you said that the CIO or the CTO should be well aware about the fact, whom are you building the, whom are you providing the services?
Whom it's impacting.
Whom is it impacting? And then, you know, build technology platform
Correct.
which is more commensurate to that, and also that you have to provide some time and space to the CTOs and CIOs, not, you know, close them that this is the deadline you have to deliver, because the result will be disastrous, maybe disastrous. Second is, objective is not to accumulate more data, but to have qualitative data which can support in business decision making.
Correct.
Am I right?
Absolutely.
Okay, so establish the fact that data strategy is extremely important for an organization. Now, coming on to the latest aspect of how data marries with the technology of today, which is AI, how in Abhay Health, or as a CEO of a progressive organization, are you looking at these two coming together and producing some really nice and meaningful results for your customers?
So, you know, I heard about this terminology sometime back from an individual, and I kind of picked it up. So he used a nice term for AI. So instead of calling it artificial intelligence, he called it awesome intelligence, right?
Okay.
And you know, the moment we talk about AI, we tend to kind of maneuver around the virtual part of it, right? And when we talk about the virtual part of it, the virtual part of it kind of gets links up with what is pre-existing, right? Now, for any organization, the marriage of a AI with the organization's existing system has to be done in line with, once again I would say, not what the organizational intents particularly are, but from where your revenue streams are impacting. So when I say revenue streams, I'm talking about the customer and the consumer once again. Whether your AI-enabled systems is doing any value addition or any good right down to the consumer whom you are supplying it for. I'll quote an example here beyond my organization, you know. Mahindra Holidays, for example, right? And I have been with them known them actually for quite some time. So we were discussing some point of time back. So they sell holiday packages, yes, right? Now Club Mahindra and its holiday packages, the moment any one of us probably would have got a call across in our life trying to sell across memberships, red, blue, green, yellow. Out of 10 calls, probably half calls would have passed through. The other 9.5 calls would have said that, you know, please don't disturb us now, right? But at the same point of time, we all, as individuals, we have our aspirations to kind of spend some time alone, along with our family. We have a particular visualization of the place where we want to stay, the room and everything. Now imagine you get those inputs pre-hand before. And even before the call is placed, probably a video gets rolled down to you, where probably you are shown there in your kind of room, with your kind of curtains, with your kind of bed sheets, with your kind of food, the way exactly you want. And then the question is asked, if you want to be here, give us a call back. And it has been tried across with roughly about a couple of thousand odd people. From a 0.5%, I would say 0.5% success rate of the outbound calls, now the inbound calls are coming in at the rate of 60%, wow, right? Just because the data which was there about an existing individual has been made good use of, and instead of now being told that what we can do for you, he's coming back and asking, where can I get it? So that's a smart use of AI which can be built up. So AI over the time can be smartly used to map and measure, because all of us, be it our sitting, eating, everything is not all of the same, right? You know, we have our own distinctive ways of doing it. So the data which comes across about in every individual, if it can be married with, whether we are going into a B2B or a B2C irrespective, if it can be married well, and then it can be walked into a pre-sales rather than a post-sales, the entire dimension would change in a magnified way.
So the example that you gave, you know, from Mahindra Holidays gives us a clear picture that how AI can help in hyper-personalizing your experience. Any other examples that you have come across specifically in healthcare where you deliver the same kind of experience to inpatient care or you know, non-patient care functions of healthcare?
So, you know, the healthcare, coming back to the point, it's a very tricky place. And when I say a tricky place, unlike where you have only, if you keep the lifestyle part of the healthcare away, which deals with yoga, therapies and other stuff. If you talk about the realistic part of healthcare, which includes hospitals and diagnostic centers and stuff like that, AI plays a major role in skill development, training, and patients attribute to what can happen. So I'm talking about the area which covers preventive health, right? Anything beyond that, with the usage of AI, also it would help tremendously when it comes to skill development of doctors, skill development of the frontline force, skill development of probably, you know, the various radiologists and the therapists. And the reason for which I'm talking about tricky is the data integrity part of it. Because without data, AI is only this much, right? And the data part of AI has to be it's kind of a river. It has to keep flowing. It cannot stop at one given point of place, right? But there are certain limitations on till what extent data can be shared and till what extent data can be utilize for a particular patient. So those limitations are being worked on. That's a challenge which AI has. But otherwise, when it comes to the preventive part, AI plays a magnificent role in the healthcare integration part.
Excellent. So I've had my share of conversations so far. Any questions, observation? Can we please have some mics here? We have some interaction coming in. Here in the middle. Yes, please. Identify yourself and then ask the question.
Good morning. Myself, Armeet Singh from Midland Credit Management. So you talked about data, technologies, just to add on, apart from AI, cloud, blockchain, considering the healthcare systems right now, these days, it's a bit sort of fragmented. You talked about data. So my question is sort of on data, though we have compliance requirements, HIPAA, and with the introduction of DPDP Act, how you see the entire dynamics of data security is going to change in coming days?
Very, very
Important
valid
question was added in my list. Good that you picked it up. Thank you.
So, you know, my answer once again will be very predictive because, to be very honest, both at the government level and both at the level of I would say the organizational, the hospital side, the core healthcare side policy makers is still being worked out, right? Yes, there is a essence of data security which is very strong there, right? At any given point of time, I will be free to let you know probably what food I want to have, what place I want to go, but what's inside my body, you know, I would not really want you to know, right? So that, but then when the data will get captured, right, it will not be placed at only one single silo. Because the very essence of having this data body is to have three different structures offering this data to you. Platform 1 will be obviously the government access points. Platform 2 will be the healthcare infrastructure access points, both public and private. And platform 3 will be at any given point of time. Suppose if me as a patient, I walk up to any doctor's chamber, right? And if I say that, you know, this is the X problem I have, the essence to have this data was the doctor will not send me back, probably, you know, asking that, you know, where you get your last tests done, how many number of tests you have to complete, or probably give me your full family history. The doctor at the click of a button can get to know my entire history, right? But the point is, how much of that history I really want you to know.
Yes.
And that's a call. So there's a public opinion which is happening while the ABDHA mission is kind of working out and integrating data at the tier 2 and the tier 3 levels, and we are building up the system. But if you see, vis-a-vis the infrastructure which we have, the data which has got accumulated so far is roughly about only some 13 odd lakhs of patient of data, right? Which is nothing with respect to the kind of huge infrastructure which is there existing. And the reason because is that of the agreement or the allowance from the individual, that is, yes you may and yes you may not. While I would say, and the reason to start it from a tier 2 and tier 3 because there the perceptions are very different. Today, in the metros, we might find very comfortable, right? We often keep our health records in many apps. We don't even realize the impact of it, right? Upload your prescriptions, upload your X-ray, upload your digitals. We keep doing that, right? Not knowing where it is going. But it's not the case at the same time when they hold medical records, probably you will see like almost like a family treasure. If they've gone to a hospital or if they visit a doctor, so they'll have a file or a box. So they don't quite divulge the data across to anybody else. So I can only say that it will come to a stage where the individual will have to give in a consent, right? And without that consent, that entire mechanism of the data flow is not going to help because the data security law, as of now, strictly prevents beyond the second party. So the doctor and the patient dealing, beyond that, no third party has the privy or the access to the data as of now.
Yeah, I mean, so personally identifiable information is very critical, and you are right that it needs to be consented before it goes to anyone else.
I would have answered you probably.
I have another question on top of it, if you allow me.
Just a minute, can we have, I mean, a little variety of questions? Any other questions for Sougat before we move on? Because I have just got 3 more minutes to conclude the session. Okay, carry on, please, if you have the second part of the question.
So that's good that DPDP Act is going to embed in the system. So my question was on that though I'm giving the consent, take an example, I'm a patient and I'm giving the consent, but take an example of the small hospital chains or clinics, how it will ensure that my data, even after giving the consent, is safe and secure. That is the challenge I'm.
So it's kind of, the way it is being worked out, it's getting worked out as a DigiLocker system, right? And everybody will get an access code, and then just like the way probably the access which is given to any, for example, you get an OTP upon your phone, right? So that's how when the transaction is going to happen. So at any given point of time, there will be 3 parallel approvals given. 1 from the data custodian, 2 from the person who's asking for the data, and 3 for the person whose data it is, right? And that's not easy. It's quite complex, quite complex. So that's what is getting worked upon. Thank you.
Thank you very much. One last question from me before we end, because just under 2 minutes.
Yeah.
So going forward, what's your prediction about some frontier technologies that will become very critical for any enterprise, including the healthcare?
I mean, the only thing which is going to become the most critical thing beyond this is security part.
Okay.
And that's going to, I mean, see, in terms of, in healthcare, technology can dwell with respect to being informative, being preventive, being operational in terms of skill developments part, adding more value to the doctor's existing ecosystem, expanding the breadth of probably the generic awareness of a doctor in terms of generic medication is concerned, expanding new age transformations in terms of various kind of operatives and drugs and molecule structure, all that is great. But with all of that, once again the impact, it's for that patient, right? And when it comes to that patient, that learning, or even if you do a surgery, probably today a robotic surgery, but then robotics is only extended to probably a few dimensions, right? Beyond that, it has its limitations. But whatever you do, at every given point of time, there's a lot of information which needs to be restricted and contained in a very strong way. And a misuse of this, today, as a country, we are probably we consider ourselves a youth country, right? Almost close to 55 odd population of ours will be in youth.
Yep.
Another 7 years from now, we are going to become an old country.
Yeah.
Where there will be 65% of our population who will be
old.
beyond 60, right? And all the youngsters, we're going to fend for the expenses for the healthcare. So that's how you see probably, remote patient management, stuff like elderly care is kind of emerging right now. So when it comes to that stage, right, a lot of it has to be security and data driven, right? So therefore, I think security and skill enhancement are the future 2 single most domains where technology and where this future would lie up.
Excellent. So a message is that organizations will have to be security and data driven. They have to have this neck for upskilling their professionals to keep up with the times. Thank you very much. My time is up.
Thank you.
Thank you very much,
Pleasure.
Sougat,
Pleasure.
for your
Thank you.
valuable time that you
Thank
spent
you,
with
Rahul.
us.